Group. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis services. Information can be found on dallasrenalgroup.com or on the Dallas Renal Group Facebook page. It's also sponsored by Comfort Care Hospice, who provide end-of-life and hospice-related services throughout the entire DFW Metroplex. My name is Dr. Paul Cespedes, and today is bittersweet. It's our last show of the season, but we will be starting up again in January. We'll have a bunch of great shows next season as well. Be sure to check out our website, doctalklive.com. Again, that's DOCTALK live.com. While you're at it, don't forget to check us out on YouTube. We have a channel there, Doc Talk Live. Be sure you like, comment, and subscribe to see more of us talking about the health topics that you enjoy listening about. Also, if you are a healthcare professional and would like to be on the show, please send a request through our website, Doc Talk Live, or through our Doc Talk Live Facebook page. Today we're going to end the season off with a very interesting topic. I'm sure, if you don't suffer from this, you know somebody who does, and that is pain. Specifically, today we're going to be talking about foot pain and wound care. And today we have Dr. Jinal Mehta and Dr. Dharmesh Bhakta in the studio with us to be part of the conversation. Please call us at 972-235-5555. Again, the number is 972-235-5555. We'll be happy to take your questions live throughout the show. Dr. Mehta, welcome to Doc Talk Live. Dr. Bhakta, welcome back. Thank you very much for volunteering your time to be part of the show. Why don't you go ahead and tell our listeners a little bit about yourselves?
Thank you for having us. I'm Dr. Jinal Mehta, and I'm a podiatrist. We practice, our group is called Accent Podiatry Associates, and we practice in Mansfield and Arlington here in Dallas. I trained in Chicago for my undergrad podiatry training and went to residency in Long Island in New York, and did an extensive forefoot and rear foot reconstruction training for 3 years, and then I've been practicing out for 3 years now. Podiatry, not everyone knows about it, so let me just explain that a little bit. Podiatry is basically related to foot and ankle issues. We deal with anything and everything from dermatological issues to orthopedic issues to diabetic wound care to simple fungal toenails, everything and anything related to foot and ankles. So.
All right, great. Dr. Bhakta.
Hey guys, how are you guys? Thanks for having us. Been practicing podiatry in the DFW area for the last 15 years. I guess I'm seasoned now. Going on for a little while. Been doing foot and ankle treating foot and ankle condition for a long time now, so I guess I feel pretty seasoned, so I don't want to talk much about it. I'll agree with Dr. Mehta, what she said, and we'll go from there.
All right. I think we already have a phone call, so let's start with that and see where things go. Hi, welcome to Dr. Live. Go ahead with your question. All right, good question.
So, to answer your question, multivitamins do help, especially vitamin B6, B12, B complex basically, which has folic acid, alpha-lactic acid, all of that. Helps with the nerve health. If you happen to be diabetic, sometimes you have that restless leg syndrome or neuropathic pain, and multivitamins definitely help with that. Along with that, the electrolytes help as well, because sometimes it could be just muscular pain, you're just not getting enough nutrients. So yes, they do help.
All right, great. Looks like we have another call. Hi, thanks for calling Doc Talk. Go ahead with your question. All right, thanks.
Yeah, this is Dr. Bhakta taking the call. It sounds like to me you had inversion sprain of your ankle, and you possibly may have injured your ligaments that holds your ankle in the right position. But with the inversion type injury, you may have injured your cartilage possibly, and that sometimes is missed on x-rays, and you're not able to see it on x-rays. So MRI may be a better test for that, but I would go check it out. You're welcome to come see us in Arlington, Mansfield. Our number is 817-557-1006, or you can visit our website for further information at www.accentpodiatry.com.
All right, let's keep going to the phones here. Thanks for calling Doc Talk Live. Go ahead with your question. All right, thanks.
So there are a lot of different reasons why someone would get restless leg syndrome. Usually a nerve compression would cause something like that, either in the back, or like I was mentioning before, diabetic usually get peripheral neuropathy, or sometimes injury can cause it too. So we do some studies in our office called nerve conduction velocity test. We have smart scans, and we can look further into which level where the compression is, and depending on that we can follow up with a treatment from simple vitamins like we were talking about all the way to surgical care where we do triple nerve decompressions.
All right, let's take another call. Hi, thanks for calling Doc Talk. Go ahead with your question. All right, thanks.
This is Dr. Bhakta again. It sounds like to me you may possibly have venous insufficiency, means probably swelling after prolonged standing or walking during the day. So one of the simple things you could do is recommend wearing compression stockings or those tight socks that goes from the toe all the way down to the knee area. But I would recommend at least getting an evaluation done by a local physician who deals with the vascular issues, along with if there's ongoing things, it is wise to at least get a further evaluation by orthopod or one of us.
All right. Welcome to Doc Talk Live. Go ahead with your question. All right, thanks.
So foot cramps can be caused because of a lot of different reasons. If it's temporary, it might just be, sometimes you get Charlie's horse, like nerve compression, and it's just temporary. But if it happens to you a lot, you could have a coalition that can cause spasms. A lot of different other diseases can cause it. So the best thing to do would be come in for a consultation. We can take a look at it. And then we can go from there. Our office is Accent Podiatry Associates, and we're in Mansfield and Arlington.
All right, let's keep going to the phones. Hi, welcome to Doc Talk. Yes, go ahead. Okay. Anything else? Okay.
This is Dr. Bhakta answering. It sounds like to me I would say at least 20% of our practice is we deal with heel pain, and so a very common condition called plantar fasciitis. So that possibly comes on the top of the list, but you may have many other things that may be going on. So it is wise to get it evaluated. However, if you start with simple stretching exercises, wear some sort of over-the-counter arch supports, maybe take some over-the-counter anti-inflammatories for short term. It may help. Icing would help as well, including maybe doing a little frozen bottled water roll under your arch and your heel. Try that, simple things first. If it doesn't work, obviously I would seek some help, such as a podiatrist.
All right, let's take another call. Welcome to Doc Talk. Go ahead with your question. All right, thanks.
So this is Dr. Mehta. I would like to tag on to what Dr. Bhakta was saying. The most common heel pain we see in the office is plantar fasciitis, and if you have heel spur, that's what is plantar fascia. It's a thick band of ligament that goes from your heel to your toes. That's what is responsible for supporting our arch. And when that gets tight, it calcifies and forms a spur once in a while. If you've tried 95% of patients do get better with conservative treatment. I don't recommend you go barefoot, frozen ice water bottle, over-the-counter inserts, anti-inflammatory. If all of that has failed, then we can build it to the next level, which goes from injections to all the way up to the surgery. So there is acute phase and chronic phase, and if you're in that chronic phase, then surgical route would be the better answer.
Is there any nutritional thing they should do that can help at all? That, as far as like avoid calcium, anything like that?
Vitamin, like I was saying before, B complex helps. Calcium, vitamin D, all of that helps, but nothing's going to take the spur away. A lot of people have heel spurs, they don't know that they have it, and that's not painful. It's inflammation in the plantar fascia is what's painful, and that's what causes the pain for patients.
All right, thank you. Let's take another call. Hi, thanks for calling Doc Talk. Go ahead with your question. All right, great, thanks.
Yeah, this is Dr. Bhakta. We deal with foot and ankle issues. It seems like you have a knee issue, so I do recommend going with an orthopedic specialist who deals with with respect to your knees. I would go with their recommendations.
Okay, folks, we're about to head in the break. We still got people on hold. We'll get to your calls during the break. We're talking foot pain with Dr. Mehta and Dr. Bhakta. Our phone number to the studio is 972-235-5555. Again, 972-235-5555 to ask your questions to our experts. We'll keep taking calls during the break, and we'll get back to you in 5 minutes. Thanks.